the award goes to John Viscogliosi from Sentinel Spine. John and his brothers founded a venture capital company back in 1999 to focus on investing and enhancing the neuromusculoskeletal industry. They have invested in over 20 companies to greatly improve the services and products that are out there. In 2008, John and his brothers founded Sentinel Spine, which is the largest privately held company dealing with anterior spinal constructs. They have always focused on bettering spine through research and contributing to education. They also focus on being a catalyst for change in the industry. And in fact, that's what John has done this year, is to hire Tiger Woods, who had his company's implant in his belly to fix his back, but hired him as a spokesperson. And I think that that's so important because of the direct-to-consumer marketing is a significant change in the industry where we now have industry talking directly to the patients. And the reason this is important is because the story of Tiger Woods is so powerful that it gives so much knowledge and hope to people that I think that that's a wonderful thing to embrace by itself. But more importantly, in this time of financial stress on the healthcare industry, it's essential that patients understand and start a grassroots campaign to preserving the access to spinal health care. Because without it, millions and millions more of Americans will become disabled. And it's by reaching out to the public, making them aware, and then empowering them to start this grassroots campaign that will be able to succeed in preserving and enhancing the access to these incredible miracles of modern medicine that we have available. And with that, I'd like to present John with his award.
And Dr. Schuler came over to me and said, "How long do you want to talk?" "You have 3 minutes." 1 to 3 minutes. So I said, perfect. So the theme of this talk is 3, because I will take all 3 minutes, because I work with a great group of people at Sentinel and throughout all the companies we've developed, but I also work with my 2 brothers. So there's 3 of us. And I'll tell you 3 stories. First, my brother Tony. How did we get into orthopedics and neuromusculoskeletal healthcare? Is when he was a young boy, he was hit by a car, a drunk driver, at 7 a.m. as he was riding his bike to the Dearborn Country Club. Had a number of orthopedic trauma injuries, and as he grew out of those injuries and then went to Wall Street, he wanted to do healthcare, and he said, because I had these injuries, I want to educate people on orthopedics and investors to move investment dollars so that they could develop better products. Story number 1. Story number 2 is Tiger Woods. When I met Tiger, he didn't think that he would ever play golf again. He didn't have the surgery to play golf again. He had the surgery so he could play with his children. The hours that we spent together talking was all about his life outside of professional golf. This is all a bonus for him. So he's very proud of what he's been able to accomplish, but it means much more about him being able to spend time with his children, with his family, being able to do everyday activity. Last story. So when I used to live in Chicago, I lived with my cousin. And he called me up 2 years ago and said he fell on ice in Chicago. He received a pars fracture from the fall, similar to the fracture that Damon had. And he calls me up and he says, "Oh my God, am I going to need to have spine surgery because my life is an expletive," which I can't say, but he thought he was going to be crippled because he needed to have spine surgery, or if he would choose to have spine surgery, he would be a crippled. So that's what clicked in my mind, said, we have to change this. Myself and my brothers have been, instrumental in helping to educate surgeons and industry about new orthopedic products, new spinal products, and moving in that direction. I thought this is a perfect time. It all clicked together that we have to educate the patient so that the patient is not so fearful of spine surgery. They know that they can get a good result, and that will mean that patients go see Dr. Schuler and the team earlier and not as the last resort, not waiting for them to be in a wheelchair and then deciding to have surgery, but actually have surgery when it was more appropriate so that they can get a far better result than what they would coming in at an end stage process of the disease. So that's why we're happy at Sentinel Spine. That's why I'm happy to support the efforts of the National Spine Health Foundation. And we look forward to that continued support and growing education for patients to make everybody feel better sooner. Thank you.
3 minutes.